Okay, so as some of you know, but maybe not everybody, I am a dietitian, retired now. I have a master's in clinical nutrition. Most of my career, though, was in corporate America in nutrition sales and market and product development globally. I did own a nutrition consulting business from 2011 to 16 before we moved down here to Nightdale. Today, I'm going to talk a little bit about the backgrounds of COVID trends that we're seeing, how to reduce your risk of contracting COVID, and nutrition and lifestyle factors that may, and I underscore may, help reduce the risk of you contracting severe illness if you do get COVID. Of course, none of this is settled science, right? COVID's not been around very long at all. So these are our best guess based on current knowledge. This is not medical advice. I am not licensed any longer in the state of North Carolina. I am not your provider. So please take all of this with a grain of salt and talk to your doctor or your primary care provider, for specifics. It is based on my wide reading of the subject and my clinical experience. But again, it's not intended to be specific for you. And I must admit, I'm a little bit of a rebel. I no longer believe what I was taught when I went through school. I think a lot of that was very dated information. And so this is based on my current understanding of metabolic health. Here's just a quick overview of COVID-19 in North Carolina. We have about 233,000 cases and just under 4,000 deaths. I made this slide about a week ago. I updated it yesterday and the numbers went up a lot. So we are definitely increasing. We have a total of 75 cases per 100,000. Most of those happen to be in Raleigh. You'll notice here on the right-hand side of the slide that our cases have gone up 40% in the last 2 weeks. Our deaths are going down, but that's because deaths are a lagging indicator. So it may not go up as rapidly as cases now because physicians are figuring out how to treat COVID patients better than they could earlier in the pandemic, but we're still likely to see the death rate go up. So, we're coming into the flu season, cases of COVID are going up, we need to pay attention. And here's in the Wake County graph, we've got just under 20,000 cases total, over 830 cases a week. That was a number that went up almost 100 a week but in just the last week, as I updated the slide yesterday. And again, the majority of the cases are in the city. So who is getting COVID now? It's the younger group, 20 to 50, about 68% of the people are in that age group, and about over half of those people have no symptoms, so they do not necessarily know that they are sick. So they can be going around infecting folks and just be totally unaware. This is a statistic that's scary for me, and that is that only 7% of the infected folks are older than 75, but 70% of the deaths in North Carolina are of 75 years or older. So I don't think we have anybody in our club that is 75, but there are several of us that are getting close. So those of us that are getting older need to pay attention. What are the symptoms of COVID? And David has run across an article recently that talks about the fact that fever is usually the first symptom of COVID. And there's a whole laundry list, many of which overlap with the flu. The one that is unique to COVID is the loss of smell and taste. We've heard a lot about the incubation period. It's 2 to 14 days, usually around 5 days for most people. But again, half of the people that are infected don't develop any symptoms. And we talked about this before too, and that, even if you get it and you have relatively severe illness and you recover, there still can be long-term complications because COVID affects virtually every organ system: heart, lung, blood clotting, and the issues with clotting affect virtually every organ in our body. And then there are the long haulers. So while some people seem to poo-poo the issue of getting COVID, one may not be so lucky as to have a light case. Who is at risk of severe illness? About 20% of those that are infected, older folks, and those with pre-existing health conditions, heart disease, hypertension, diabetes, lung disease, and obesity. So I'm going to be focusing most on these: heart disease, hypertension, diabetes, and obesity, because those are the things that we as individuals can control. In addition to taking medications, there are lifestyle and nutrition issues that we can do to manage these. And this is just a chart looking at the relative risk of the various things. So cardiovascular disease is most, and this is high blood pressure, COPD. Who's dying from COVID? Again, you can see it ramp up as we get older, and in these years, men seem to be at higher risk of dying than women. About 2.5% of those that are infected die. And again, that number's going down, thankfully. There's some things on Facebook as it relates to the fact that the numbers are overreported in COVID. And they're probably actually underreported because it takes a while for the health authorities to go back and to say, okay, yes, this death was COVID. And there's also this real lag between when the death actually occurs and when it gets reported to the health departments. So we know that the numbers now are not the formal numbers, and it will likely go up. And the CDC estimates that in the entire United States, and this is through September, so we're a couple weeks behind, that in the United States, there's somewhere between 208 and 274,000 deaths that are excess of what we would normally expect to have during this period of time. So they're excess deaths associated with COVID. And similarly for North Carolina, 900 to 2,900 excess deaths. This is really important because our understanding of how COVID is spread has changed over the months. It's now pretty well established that the primary way it is spread is through airborne aerosols. And it's not just those bigger drops that drop to the floor within 6 feet. It is smaller particles, the aerosols that can stay in the air for a very long time. And you don't have to be singing to spread them. Even breathing, which I think we all do, can cause the spread of aerosols. So it's any of these things. So speaking, singing, shouting, coughing, sneezing, this is the way we spread it. So if you wear a mask and the other person wears a mask and you stay at least 6 feet away, that's a way to mitigate this risk. There is something or a possibility of transfer from objects, from touching something and then touching your eyes or your nose or your mouth. And there was something that just came out yesterday that says that COVID can last on surfaces for up to a month. I think that was in a lab setting, not necessarily relevant to the real world, but nonetheless, it is possible to transfer. So pay attention, wash your hands, don't touch your face. So the biggest factors influencing your risk are your proximity to others. You should keep at least 6 feet apart. Recognizing that things like coughs can travel 30 feet. So 6 feet's not a magic number. Ventilation, outdoor activities are a whole lot safer than indoor. And in a closed environment, aerosols can actually fill a room. So if the ventilation is poor, even just a few people in the same small space can infect the whole lot. Obviously, time. The longer you're exposed increases your risk. And the percentage of people wearing masks and practicing social distancing also influences the risk of spread. Wearing your mask properly. We've all seen people like this character, down here, the nose is not covered. Well, if the primary way that you spread COVID is through breathing, and most people breathe through their nose, if you're not covering your nose, you're not yourself or others. Same thing with the chin or around the neck. So the proper way is to cover from the nose all the way down to the chin and to not have gaps. Whoops. And if you wear a mask, it reduces the risk of infection for others as well as yourself. And if you do get infected, you may have less severe illness. Masks should have at least 2 layers of fabric. You should wash your hands before and after removal of the mask. And ideally don't touch the mask while it's on, and that's hard. So try your best not to touch the mask. It's recommended that you do not wear gaiters. And there's the initial word was that they simply, as they cover your face very tightly, they allow the aerosol particles to become finer as it goes through that material, and those finer particles actually are more easily spread. There's some other stuff out that indicates that maybe multiple layer gaiters are okay, but right now the CDC does not recommend gaiters. Certainly the same thing for open bottom bandanas, because if you're not controlling the aerosol within the mask, it's not effective. And also we see quite a few of the masks with vents, and those masks are made for construction industry so that the individual wearing them does not get the dust from whatever they're doing, but it allows the person to exhale more effectively. Well, if you're exhaling more effectively through a mask, it means it's not effective against COVID. So wearing masks with vents is not effective. Same thing with face shields. The only people that need face shields are medical care providers that are doing high contact procedures with patients with COVID. And that's their second layer. It's not their first layer of protection. So for you and I, wearing a face shield without a mask is not helping anybody. You should wash your mask after every use. So you need to have at least probably 7 masks, I would imagine. If everyone wore a mask, we would reduce the risk of infection by 80 to 98%. So this is really important to wear a mask, and it's not a political issue. It's simply a public health issue. We need to wear a mask to protect ourselves and to protect everyone else. And everybody's talking about, we can hardly wait till a vaccine comes. Well, when the vaccines are approved, their bar for approval is just 50% effectiveness. So masks are better than a vaccine. And so undoubtedly, when we do have a vaccine, we're going to still be encouraged to wear a mask. I'm going to take a breather. Anybody have a quick question? No? Okay. So wear a mask, wear a good mask. Okay, so risk mitigation. I'm going to call it layers of protection. If you do all of this, this is your best opportunity to reduce your risk. So, the North Carolina Department of Public Health has been saying this for a long time. It's the 3 W's. You wear a cloth mask, at least 2 layers, cover your nose, mouth, and chin. You wait at least 6 feet apart. Again, further is even better. And you wash your hands, or if soap and water is not available, you use hand sanitizer. And soap and water is more effective than hand sanitizer, so don't just use hand sanitizer, use that soap. And then when we get a vaccine, we can layer on the vaccine to all of these things. So that's the layers of protection. This is from the CDC. It reiterates much of what we've talked about. The only thing is that this includes all respiratory germs. So it's things like using a tissue and throwing it in the trash. So if you have flu and you're at home, that's a good public health policy. Also cleaning and disinfecting frequently touched surfaces we've talked about. The other thing is staying at home. I know that when I was working, it was a big deal. You go to work when you have the flu, and there was oftentimes a big push to go to work when you've got, some sort of respiratory illness. We now need to stay at home. I think it's pretty clear. Okay, these are the relative risks of various activities with masks and with social distancing. I'm not going to read them all, but I'll let you take a look. Lower risk is bigger spaces outdoors, minimal contact with other people. Now, something that's really cool, David just found this the other day, it's a lot of fun, is this little, and oh shoot, I meant to put it in the chat. I'll do it after I'm finished yakking. I'm going to give you several links. And this is something you can go to, mycovidrisk.app. It's from Brown University. You can put in all of your criteria. How long is it going to be? Oh, and you put in your own zip code. So we know that if it's really, if there's not much COVID in your area, it's going to be different than if you're talking about an area like maybe Raleigh where the COVID risk is higher. So you put in where you're located, how long, how many people, what percentage of people are masked, and then it gives you a relative risk. Now this is not perfect, but it gives you a relative risk of that particular activity. So I did it for our club meeting. If we were to go back to the Chamber of Commerce and meet in person, we stay there for an hour, about 14 people show up, everybody's doing good, they're wearing your mask, it's still a high risk activity. We cut our meetings down to a half an hour, same deal, 14 people, everybody masked, it's down to a medium risk activity. We'd meet outdoors in the rain and everybody's masked, that's very low. So this helps you figure out, you know, what is the relative risk of a specific activity, and is it worth it to you individually based on your personal risk if you should get COVID? Okay, so now here's the part that's kind of my bailiwick. So many chronic diseases, more than just diabetes, are linked to insulin resistance. Insulin is a hormone we produce as a result of eating. Diabetes is clearly, most people know that if you've got type 2 diabetes or even type 1, you've got an insulin problem. And insulin resistance is an issue there. But it's also associated with the other more common diseases we have, including heart disease, hypertension, obesity. And then these others in the list aren't related to COVID, but a lot of people get them: cancer, dementia. Many people call Alzheimer's now type 3 diabetes because there's such a close link between diabetes, insulin resistance, and dementia. Also asthma and arthritis. So if you have anything on this list, if you deal with your insulin resistance, your situation is likely to improve. So who is insulin resistant? Virtually everybody, 80% of US adults. So this is a quick down and dirty way of doing it without needing to get any blood tests. You take your waist to height ratio. So for men, that's your number, it's 0.536, and for women, you're slightly smaller. So basically for men, typical height man, 37-inch waist or above, you're insulin resistant. Women, 32-inch waist and above, you're insulin resistant. But you can do your own calculations. That'll be more accurate. So most adults are insulin resistant in the United States. The good news is you can quickly improve your insulin resistance on a low-carb diet. And the reason for that is that low-carb diets preferentially reduce visceral fat. That's the fat around your internal organs, and it's that fat in your liver and your pancreas that most impacts insulin resistance. So, what is it? If you eat food, particularly carbohydrates, that causes your body to make insulin. Also eating protein and not eating fat. So fat does not cause insulin, carbs do, protein to a lesser degree. So you eat something, it makes your body make insulin. Eventually, if you eat frequently and a lot of high carb foods, your body says too much insulin, it's causing problems, too much carb, but it's still causing problems. So kind of analogous to antibiotic resistance, your cells become resistant to the impact of insulin. When you've got all of this insulin, body store anything you eat is fat. And then you feel tired and hungry, and then you eat, and it's a circle. On this side, what causes insulin resistance? Now, I took this graphic off of a site where I can get free graphics, and they actually had obesity is causing insulin resistance. And the thinking now is that actually it's reversed, that insulin resistance causes obesity. certainly there's a very close relationship here. So if you're inactive, your genetics plays a role as you get older, some medications and other disorders. Insulin resistance, again, causes obesity, type 2 diabetes, polycystic ovarian syndrome, atherosclerosis, dyslipidemia, in other words, high cholesterols, and high blood pressure. So again, insulin resistance leads to high blood sugar and high levels of insulin. High blood sugar increases susceptibility to dangerous infections. Diabetics are known to be at higher risks for pneumonia, for infections in their legs that cause severe things like amputations. So having high blood sugar by itself leads to a risk of dangerous infections. Also, high insulin forces sugars into your fat cells. So it prevents you from burning stored fat. So if your insulin is high, you're going to be fat. And so getting your insulin down helps you to burn excess fat if you happen to have it. So to do that, you reduce your carbohydrates, that reduces your blood sugar, that reduces insulin resistance, and it allows you to lose weight. So when I was in private practice, not everybody got a low carb diet, but most anybody that was overweight got a low carb diet because I think it's the most effective way to handle a long list of metabolic problems. So again, this is not advice for you. You need to talk to your doctor, but I do believe that low carb diets are not only effective, they are safe. They reduce blood sugar, blood pressure, weight, inflammation, things like arthritis and skin conditions. And because it handles all of these metabolic issues, it may reduce your risk of serious complications should you get COVID. And one of the easiest ways you can help reduce insulin and blood sugar is to skip breakfast. I know we've all heard breakfast is the most important meal of the day. I firmly disagree. In any case, you may want to skip breakfast. Intermittent fasting for 16 to 18 hours, which would be if you just have lunch and dinner and don't eat after dinner until the following lunch. That does reduce your insulin, your blood sugar. It allows your body time to fight viruses versus digesting food should you be fighting the flu or COVID. Okay, again, none of this as it relates to supportive immune function, and COVID is known, confirmed science, but it is our best guess. Vitamin D is a vitamin. It's also a hormone. You produce it when you go out into the sun. There's a very strong correlation between people with insufficient vitamin D status and serious disease, both flu and COVID. So who is at risk of vitamin D deficiency or insufficiency? Nobody in this country, or very few people, have rickets these days, but that doesn't mean that we have enough vitamin D. The people that are at risk of vitamin D deficiency are people that don't get out into the sun. If you are obese, you may have sufficient vitamin D in your body, but it might be in your fat cells because it's a fat stored vitamin. It may not be in your blood where it's needed. So if you're overweight, you probably have insufficient vitamin D in your blood. If you have dark skin, you do not make vitamin D as efficiently when you're in the sun. And we're coming into winter. None of us make good vitamin D now because the sun is not high enough. So at this time in the year, I think everybody needs to be on supplemental vitamin D. And, you know, it's probably not a bad idea year round. Somewhere between 1,500 and 2,000 international units a day. I'm going to see my primary care provider at the end of the month. I'm going to ask her to test my vitamin D status. And if it's high, I may reduce my own. But you need to know your number. It's easily tested, but it requires a blood test. There's minimal risk to overdosing on vitamin D, or basically none at these levels. You can if you take higher levels consistently. But I would say it's a good protective thing to take some vitamin D now. Also reducing your carbohydrates, eliminating sugar. So sugar in all forms, be they juice, sodas, sweet tea, That'll help reduce your insulin. But, you know, sugar's elsewhere. It's in fruit. It's in almost anything we eat that it comes from a package that has more than one ingredient. So reducing sugar will help reduce insulin resistance. Jeff?
A quick question about reducing sugars and diet drinks. Could you address that either now or at the end, how Diet Coke, because I love Diet Coke, it's my favorite drink. And I've heard that it tricks your body into something having to do with sugar or insulin. And if you could do that later, that'd be great, or now, whenever it's appropriate.
Yeah, I'll do it at the end and wrap up and take, but yeah, that is actually kind of a controversial thing, but okay, yeah, we'll get to it. Another one. Okay, so going back to the day when I was a baby dietitian, we were just learning about polyunsaturated fats and how to reduce heart disease. And I used to actually recommend that my patients increase the amount of corn oil in their diet because that was higher in polyunsaturates. We now know that these industrial seed oils, so these are oils from things that you wouldn't be able to produce if you were on a farm. So if you're in Italy and you're on a farm and you've got olives, you can squeeze those olives and you can get oil. That is a natural oil. That is fine. But if you're a farmer in Iowa and you squeeze your corn, I don't care how long you squeeze it, you ain't getting corn oil. And same thing with these others. All of these oils are inexpensive and they all actually increase inflammation. And even though we've heard canola oil is great, it actually is not. So reducing industrial seed oils will help reduce inflammation. So that essentially means processed foods need to go away because they're in every processed food virtually. So we want to increase omega-3 fats. Those are the fish oils from things like sardines, salmon, mackerel. These do reduce inflammation. So my grandma, who is older than any of your grandmas, had on her stove a can of bacon fat. We need to do what grandma did. That was fine. That is not inflammatory. So use the fats that grandma knew. You know, she used lard because they slaughtered the pigs and had it. They made butter from the milk. Do what grandma did and you'll reduce your inflammation. Perhaps supplementing with vitamin C. This one is less needed or obvious to me than vitamin D, but it probably is not going to hurt. You can also get vitamin C from things besides fruits, which again, fruits are high in carbs, but things like leafy greens, broccoli, green peppers are all high in vitamin C. And using the low carb fruits like berries would be okay. Don't drink juice. That's nothing but sugar water. And then zinc is perhaps helpful in colds and flu season. You can get it from things like red meats, liver, and oysters. So we eat smoked oysters once a week, give or take. Oysters are a great source of zinc. Okay, so to reduce your insulin resistance and oxidative stress and inflammation, reduce sugar in any form. It's mostly in processed foods. You need to reduce or limit or avoid entirely grains and high carbohydrate foods and seed oils that we mentioned. Also, of course, alcohol, tobacco, and nicotine also impact inflammation and oxidative stress. And in this time of COVID and in crummy air or worse air than decades ago, it would not be a bad idea to replace your air filters at home more often. You may want to add things that are nutrient dense, things like deeply colored berries, low carb vegetables. Those are the ones above ground. So potatoes, carrots, rutabagas, turnips, all of those things that are in the ground are higher in carb than things like kale and spinach and green beans that grow above ground. Fatty fish, salmon, sardines, mackerel are a great source of those omega-3s, using natural fats, as we've mentioned. And then activity, especially outside. In the summer, that gives you a little vitamin D. In the winter, it just gives you an opportunity to relax. And then again, I recommend supplementation with vitamin D and maybe vitamin C as well. Stress and relaxation. My personal story was that Doris, don't listen. The year that I took over as club president, I was club president 2 years back to back. I entered that year at a good weight. I gained 20 pounds in the first 6 months of being club president. I think that was stress. And then it has taken over it. Now that I've been out of this district governor's thing, the weight is coming off because the stress is down. So stress is real as it relates to health. So outdoor activities, doing something that helps you reduce your stress, prayer, meditation, mindfulness-based stress reduction, walking, meditation, exercise, and sufficient sleep. And we were talking earlier about sleep disturbances. I don't recommend it every day, but if you do regularly have problems with sleep, melatonin is a very effective way to go. But you don't need much. The typical thing you find in a grocery store is 3 or maybe 5 grams. I take half of a gram and it does the trick. So you don't need much. And if probably shouldn't take it every single day. But anyway, if you do have trouble sleeping, that is an approach you may want to consider.
Marie?
Yep.
I just want to point out it's not grams, it's milligrams.
Oh yeah, there's a difference. It's it always gets me when we talk finances. It's always a decimal point, So yes, it's milligrams of melatonin, and yes, half of 1 milligram does it for me. Okay, get your flu shot. It's not going to do anything for you as it relates to COVID. It doesn't protect you against COVID. It protects you against the flu. But an observation study in Brazil shows that people with a flu shot were less likely to die from complications of coronavirus. Also, because the symptoms of the flu and COVID are very similar, it'll be easier for the doctor to know what's going on if you've had your flu shot, and he can say, okay, well, you've had your flu shot, maybe it is more likely to be COVID. So protect yourself with the flu shot. So the health is in your hands. So do some things that you can do to reduce your risk of any number of chronic diseases. Stop smoking or using other sources of nicotine. Improve your metabolic markers by reducing your carbs. Limit alcohol, lose weight, get stronger, manage your stress, and then do the wearing a mask, waiting 6 feet apart, and washing your hands, and then layering it on. I think I've got one more slide, and then I'll open it up for questions. This was my cute baby picture. Just like you wouldn't let a little munchkin go outside today with just his diaper, it's too cold, you would layer that baby up. We can layer ourselves up as we look at it, reducing our risk of infections. Wear a mask, socially distance, wash your hands, clean those high-touch surfaces, improve your health through, taking care of obesity, high blood pressure, diabetes. Eat well, increase activity, limit alcohol, and avoid nicotine. These are boring things. We hear them. But if you ever needed motivation to get healthy, now is the time, because getting healthy now and improving your metabolic health can reduce your risk of COVID or serious complications if you should get it. Okay, I'm going to send you, once I stop sharing my screen, I'll add this. There's a whole bunch of resources I'm going to give you if you want to dig deeper. You don't need to believe me. Here are some resources that go into this. This first one, Dr. Beichman, talks about why we get sick, and he talks about insulin resistance. And he's a PhD. Oh, I can't remember. But he focuses all of his research on insulin. I mean, this is his thing. It explains how insulin resistance really does affect many of our chronic diseases. This next one, the Diet Doctor format in this particular podcast talks about, this is an ICU doctor in he's in Canada, who, talked about how he was seeing all of his patients who were overweight and had hypertension and heart disease in the ICU with COVID, and how he realized that we really do need to address our metabolic health now. It's a pretty good interview. And then this is some information on low carb and keto dieting. Dr. Eric Westman is a physician here at Duke. I've had the pleasure of meeting personally. He is very down to earth, and he's, just calls it like he sees it, but he's a clinician that can speak to people very understandably. And he was one of the co-authors on the New Atkins for New You, and he's all over YouTube with various things. One of the other approaches David and I are messing around with right now is something by Jason Fung. Jason Fung is also a Canadian physician. He's a nephrologist dealing with kidney disease. He treats all of his patients through fasting to get their insulin and blood sugar down and to help them lose weight quickly. He talks about how to do it. Basically, there's lots of ways to approach it, but usually the easiest way is to start by skipping breakfast and then reducing the amount of time during the day to a short window of not eating. And once you've been low carb for a while, it's not so hard. It's really hard if you just were to start from, eating your Bojangles and then going into fasting. That would be a tough road to hoe. Other resources on Primal Diet, which is another low carb-ish approach. Another low carb researchers, the art and science of low carb living. If you've got an autoimmune disease like Hashimoto's thyroiditis or rheumatoid arthritis or the list is very long of autoimmune diseases. This is an excellent resource called the Paleo Mom. She has something called an autoimmune protocol. And then on the far end of low carb diet is carnivore. And I think that's it. Q&A. So to Jeff's question, okay, so diet drinks don't have carbs, right? So they don't increase your insulin. But, okay, so in my personal practice, if people really needed diet drinks in order to keep on keeping on, I wasn't going to argue that fight. That was not the most important fight I was dealing with for these people. But there is something to what you said that they might increase the insulin response of some people. It's called the cephalic response. So I don't know if you remember, but I remember so distinctly when Cinnabons came into being, and you'd walk into the mall and you'd be surrounded by this delightful aroma of cinnamon buns. And just that thought, and I'm sorry, I've done it to y'all right now by just bringing that thought to mind, just thinking about cinnamon buns, the body says, food is a-coming. Let me get ready. I'm going to pump out some insulin. And that's because your brain says food's coming. It tells your pancreas to release insulin. So tasting sweet, even if there's no calories in it, might stimulate insulin. And I think for some people it is important. I don't think it is the most important. But if you're doing everything else right and you're not losing weight and you're still drinking diet drinks, get rid of the diet drinks.
Do you think it has anything to do with if your body is prone to insulin resistance? I mean,
I don't know that there's a uniform answer.
Okay.
I mean, I've been working on trying to reduce mine.
I'm trying to figure out how to justify drinking the Diet Coke that I drink because I'm
not going to justify it for you, Sweet Pea. Sorry. No, I mean, it's not the worst thing you've done, right? But if you're trying to dial it to perfection, Jeff, if you want a perfect Jeff Tucker body, get rid of the Diet Coke.
I'm there.
Okay, then you're happy. Any other questions?
Yeah, I was a question about COVID, and I don't know if you've heard this, but one of the things I think is really odd about it that I'm not in the medical field at all, but is the stat about 50% of people that have it, there's no symptoms. Have we ever had anything like that before with any type of virus?
I do not know that either. I'm going to refer to my virologist husband, David. I am not aware. Nothing is coming to mind that,
we don't have that with the flu, right? Like there's not a no symptom flu.
Well, I think that there's probably for people a range of symptoms. Like I've got asthma, so if I get the flu, it's worse usually than somebody who doesn't.
You feel something now.
Yeah, I feel something. David, do you know of any other virus that doesn't show symptoms?
Not in the sense we're talking about, but there are a number of viruses that can lie dormant in the body. You don't know you have them. And then at some point, something will trigger it, and there will be an outbreak. And the classical one is a cold sore. It's caused by a herpes virus. And virtually every human being has herpes virus in the body. But it doesn't cause any problems in a huge majority of people. But a few people will break out in cold sores, or if you have the genital herpes, then you'll have genital warts. So it's not quite the same, but viruses certainly can lie dormant. And I think the other thing about COVID, it's a sneaky virus. It basically infects the epithelial cells that line blood vessels. So it gets into the bloodstream, it infects the walls of the blood cells. Now, of course, blood goes everywhere in the body. Every single organ has blood. And so the virus is spreading throughout the body. But at the same time, your immune system is kicking in. And some people probably have a effective immune response. But in those who don't, those who get severely ill, the virus, because it's spreading throughout the body, is causing much more serious illness. So I don't think that answered your question, but there are sort of other viruses that certainly can lie dormant.
Okay. And let's just say in a perfect world, we had something that you could, a rapid test every day. This is something that's confusing me too, because you've got these bubbles, you know, like with basketball and hockey did it, and baseball's doing it now, where, you know, they're not doing anything except, you know, going to the hotel, coming back, getting tested every day. If we had a rapid test where, you know, in 10, 15 minutes, you knew if you were positive or not, what about that? Like, I mean, like, what about then the mask wearing and that's what kind of confuses me about the sports bubbles, is that they're getting tested all the time, and yet everybody's still wearing masks. But if you're not positive, then
the problem, Phil, is that, well, number one is we do not have highly accurate rapid tests. They have high false negatives. In other words, you will be infected with a low level of virus and it will not detect it. The other problem is, if you and I get tested right now, we could get infected an hour later.
Okay.
And so at the moment you're tested, you are negative, assuming the test is accurate enough to determine that. But at any point after that, you can do it. And so I think we're going to have to continue to wear our masks until we get an effective vaccine. And I'm going to say it, if we ever get an effective vaccine, don't hold your hopes on a vaccine. There are lots and lots of viruses for which we have never been able to develop an effective vaccine. Flu, cold, and there's lots of others.
AIDS.
Go ahead.
No, I'm just saying HIV is another one. So to David's point, we're going to have to continue to practice these 3 W's for the foreseeable future, and to recognize that, we are not only trying to prevent ourselves from getting it, we're trying to prevent spread to other people. I just placed in chat several. The first one is a link to the resources. It's a laundry list of all of those things that were on the slides, the various books and videos. The second link here, I'll pull up in a minute, is a link to our brand new YouTube channel, where we'll be storing our videos of our presentations for this and our sister club, the Social Justice Club. And then this last link here is to our Nightdale meeting schedule between now and the end of this calendar year, so through December. So if you want to know what's coming up, that's our schedule. Any other questions as it relates to nutrition or COVID? David can get those. Okay, so just to share some personal stories. So David and I finally got our act together with this low carb thing. We've been saying are low carb for a long time, and we, go at various, levels of low carb. And so finally about 2 months ago, we said, all right, let's just get back on the wagon kind of thing. And so in the 2 months, I by the way, my blood sugar's always been fine, but wasn't fine. And I was watching it go up and saying, okay, well, maybe you need to get with your doctor and get on some blood pressure meds. We went on low carb within 4 days. 4 days, my blood pressure was down to normal. And then blood sugar took a little bit longer. Both of us, our numbers are absolutely either perfect now or absolutely going in the right direction. Between the two of us, we've lost 30 pounds in less than 2 months. Of course, people lose weight at different levels. So what I want the message to be is we've always heard these things of, don't smoke, moderate drinking if you drink at all, lose weight. We've heard that for a long time. It's important now that we do it. And if you follow a low carb, you can do it with reasonable ease. I will say that if you go from 0 to low carb overnight, it is a miserable experience because your body is used to burning sugar and you're no longer giving it sugar. You're asking your body to burn the fat that we carry around, and it's not primed to do it. So it needs to ramp up the enzymes. It needs to burn that fat. And the reason one feels miserable is because you lose a lot of sugar, you lose a lot of water when you first go low carb. You store a little bit of carbohydrate in your liver, and that's what your body uses right away to fuel you when you're not eating sugar. Well, with every gram of that glycogen that the body burns, you lose 4 grams of water. So if you go from a normal American diet to low carb, you'll be in the bathroom peeing a lot. And with that, you will also use a lot of sugar. You will lose a lot of salt. So when you first start on low carb, to reduce some of the negative lethargy and some people get headaches and just feel blah, increase your salt intake actually quite considerably and make sure you're getting sufficient fluid. And that helps a good portion of those symptoms. When I used to see clients and we'd talk about this transition, I'd say, first week, just know you're not going to feel on your top. It's going to feel kind of crummy. Second week, a little bit better. And the third week, you're going to be singing my praises because you feel so good because your energy is high and it's easy. But you just need to get through those first 2 weeks. It's really the first week. The New Atkins for a New You talks about that, about how to minimize what they call carb flu or keto flu. But once you get there, like David and I are both beginning to increase our time when we're not eating at all. I went for 42 hours. Monday, I didn't have anything. So I ate dinner on Sunday. I didn't eat again till lunch on Tuesday. It was fine. The first time I did it wasn't fine because I hadn't been low carb long enough. But now it's really not a big deal. And so it's worth it to, give this a shot. And anyway, so I'm off my soapbox.
I guess I'll second that. A month ago, if you had asked me to go for 24 hours without eating, I'd have told you were crazy. I've done it twice in the last week. And the thing about going on a low carb diet is that you do not feel hungry. And I found it easy to go 24 hours without eating. And by the way, my metabolic indicators are, I am pre-diabetic. So I'm not a full-blown type 2 diabetic, but I'm on my way. I've been able to get my blood sugar down to almost normal. I'm still a little bit high, but almost normal. This stuff really works. A number of years ago, on a very similar low-carb diet, I lost over 60 pounds, and all of my blood parameters came into the normal range and stayed there.
So we went up to Michigan a couple weeks ago to see my dad. It's a 15-hour trip. We drove nonstop, rotating drivers, and we did not eat the whole way. And it was fine. You know, it was easy. You don't need to eat, just need to drink some water along the way. So, any other questions? I guess I see what else is coming up, Doris. I'll get the screen again. Oh, stop the recording, Doris.